Hello everyone. We are going to do a little bit more NSAIDs, some additional NSAIDs, so please add this to your studying. Yes, it is on the exam. Yes, it is still important. I put that here not to be condescending or anything to you guys, but in the past I've done part 2 lectures, and for some reason there's been some students that haven't studied those because it said part 2, or I'm not sure why they didn't study it. But so yeah, please, all these drugs are testable material. These are just additional NSAIDs that were not covered before. You're going to notice a lot of patterns here, a lot of things that match the NSAIDs in the previous lectures, and then a lot of things that just match within this lecture. So let's get started. Meloxicam, this is generic from Mobic, very popular NSAID. Mechanism of action, just as a reminder, I went ahead and spelled it out for you guys here, but it is the same as other NSAIDs. So the good thing with we're studying for this drug is you can use the same classification for the NSAIDs and also same mechanism of action. So there it is for you guys. So basically, it's the reversible inhibitor of the reversibly inhibits the COX enzymes. And remember, again, with the NSAIDs, the aspirin's a little bit different. So go back to those other notes if you want a refresher on that. This one is used, like I said, it's very popular, specifically FDA-approved uses, osteoarthritis and rheumatoid arthritis. And the rheumatoid arthritis, the FDA approval is only with the tablet and suspension. But, you know, that's just an FYI on that. Just when you're studying osteoarthritis and rheumatoid arthritis is what you need to focus on. So go ahead and please read through those. Adverse reactions. So this is interesting that there's a note on the adverse reactions from Meloxicam that they actually can vary depending on your patient, if you have a pediatric patient or adult. So these percentages are reported for adult patients, but they are similar in pediatric patients. I'm sorry, for the most part, but specifically abdominal pain, diarrhea, fever, headache, pyrexia, vomiting were reported more commonly than in adult patients. So these right here, these adverse effects up here are going to be more common in your pediatric patients than your adult patients. But as a whole, you'll notice this with a lot of the NSAIDs, and we've already talked about this before. GI adverse effects, go ahead and put a star by that, common with these medications. We also have respiratory adverse effects, not as common. You notice the upper respiratory tract infection can be, less than or equal to 8% here. But these are related. Part of the reason I included those is because they are related to the contraindications. So hypersensitivity makes sense. We've seen that before. Also, you have to be worried about a history of asthma, urticaria, and other allergic type reactions after taking aspirin, which is, the prototypical NSAID or other NSAIDs. And then it is contraindicating the use during CABG surgery. Related to that and things we've seen before, you'll notice the box warning. So as always, please pay attention to these. But serious CV events, cardiovascular events, and serious GI events, serious GI bleeding, ulcerations, perforation. So please read through those. And you'll notice that throughout this presentation, like with the previous NSAID presentation, you're going to see this box warning for all of the NSAIDs. So definitely something important to have as a generalization. With all the NSAIDs, you need to be thinking about cardiovascular thrombotic events, and you need to be thinking about GI adverse effects, and then serious GI effects that are related. Specifically, too, we're going to highlight the elderly patients are maybe particularly vulnerable for this. And so at the end of this presentation, I'm going to go over the Beers criteria and show you kind of the recommendations. And there's some specific NSAIDs that you should absolutely avoid, and there's others that they have some other recommendations on, which we will talk about here in a second. Nabumetone, mechanism of action, same as above. Uses, this just has arthritis as its FDA-approved uses, and so it can help with signs and symptoms with both OA and RA. Adverse reactions, again, probably not a surprise. Most common adverse effects there, GI adverse effects. Contraindications, again, noticing that pattern throughout this presentation. Contraindications are also very similar to the other NSAIDs we've seen. And then box warnings, again, very similar. I'm not going to read this to you guys. I don't want it to get too boring. But yeah, so hopefully this will make it easier for studying purposes. When you're studying your NSAIDs, you can put a lot of these things, or their class box warnings, class adverse effects. So I think that helps, or at least used to help me when I was a student, when I was learning new drugs and new classes of drugs. Mefenamic acid. Pretty easy mechanism of action as far as we've already seen it before, same as above. Use, pain, mild to moderate, and then primary dysmenorrhea. So that can be a little bit different than some of the other NSAIDs. NSAIDs in general, especially over-the-counter NSAIDs may be beneficial, and patients may take them for dysmenorrhea or cramping or whatever. But this one's specific, prescription strength one that can. Please make sure you're paying attention here and you're noticing that this should not be used in pediatric patients. So the patient needs to be older than or equal to 14 years old. And then there's a limitation on this medication that it should not exceed 1 week. So please notice that when you are studying this medication. Adverse reactions, have some more here that are more common. So you notice it's not as well tolerated as some of the other NSAIDs, but definitely you're seeing again, you have the GI adverse effects to be concerned with. But go ahead and read through this as well. Dizziness is one that's something that you always think about with NSAIDs, but that is something that can be up to 9% of your patients here. So that could be troublesome and problematic. Contraindications, again, seen these before. Just going to read through them. Box warnings, again, seen this before. This presentation is getting hopefully not too monotonous here. All right, next medication, Meclofenamate. Mechanism of action, same as above. Uses, so some different uses here. Definitely make sure you go and read through these and make sure you note that these can be used for, they have an FDA approval for a lot of different things here. So please study all of those. Adverse reactions. Again, you notice dizziness is here as an adverse reaction, and then the GI adverse reactions. Again, hopefully you guys are noticing a pattern here with these NSAIDs. Contraindications, same. Box warnings, same. Etodolac, mechanism of action, same as above. Acute pain, and this is for the immediate release preparation only. So they make an immediate release, an extended release, which is ER, stands for extended release. So your extended release should be used for your arthritis patients. So OA, RA, and JA. And then the immediate release can be used for your acute pain patients. Adverse reactions, again, let me change something a little. Okay, I just didn't like the way that looked. I just did a little minor tweak. Nothing important. Here are going to be your common adverse effects here. And you notice with the percentages and stuff that, some are more common than others. Dizziness, again, is an issue. And the GI adverse effects are an issue. Contraindications there, stuff we've seen before. Box warnings, definitely have seen those before. Flurbiprofen, same as above, mechanism of action. Uses, on-label use, RA, OA, so arthritis. Off-label, post-operative pain, so you maybe see that after surgeries. They make a eye drop of this as well, so we'll be revisiting this in the ENT presentation, module. But specifically for the eye drop formulation, it's an ophthalmic solution. You can use it for intraoperative miosis. Adverse reactions, here we go again. The frequency is not defined, but definitely I would, make sure, note GI adverse effects. Contraindications, we've seen these before. Box warnings, we've seen these before. One note on the box warning for this one, the eye drops do not have the same box warning as the oral medication. So that's just something to note when you're studying. Eye drops don't have to worry with the box warning. But adverse effects and everything, mechanisms of action are the same for both the oral medication and the eye drops. Beers criteria. So this is something that I've talked about before, but I wanted to make sure we specifically visited it and spent a little more time with it, and it's relevant to the NSAIDs. So this is initially developed for nursing home patients to help providers figure out which ones were appropriate, inappropriate, which ones have more adverse effects for older people, which ones are safer, more dangerous. And then it gives, what I like about it is it gives specific recommendations on how to manage and what to do with your patient population. And like I mentioned before, I worked as a nursing home consultant for a year up in Oklahoma, and I heavily relied on this. So I definitely encourage you guys, if you're doing any kind of geriatric rotations, have any geriatric patients, etc., definitely keep the Beers criteria in mind. There's some other, there's also the stop-start criteria, I believe, where it's another tool to help you with picking appropriate medications for your geriatric patients. So let's take a quick little field trip, as I like to call them, and check out the Beers criteria. So just real quick, I want to show you guys, I'm getting this all from Up to Date. So this is let's see what this is titled. Drug prescribing for older adults. So definitely there's going to be way more way more information here for you all. But this is where I'm using this to get the hyperlink for the Beers criteria. So notice they have this section here. Well, polypharmacy is an issue, which is something that I believe you'll be covering in your other courses. But that just basically means that with elderly population, you need to be mindful of polypharmacy. And what is polypharmacy? It is where a patient is on a lot of medication. So you can have polypharmacy with elderly patients and with your young patients, with any patients, but it's just basically something that you need to be mindful of, and always try to reduce medications if you can, and make sure there's not duplicates as far as like they're not on a few different things for the same indication unless they need to, or if they're on they're not on 2 different types of beta blockers unless they for example, or but anyways, under inappropriate medications you have the Beers criteria here. All that stuff I mentioned. So if you click here on this hyperlink, and the hyperlink should work in the slides, I don't know if it did, but it's linked here to the American Geriatric Society update. That was updated in 2015. So if you will notice it here, didn't mean to click on that. Just do Control F or whatever. Find NSAIDs. Let's pull this down here. You'll notice it's going to be sideways, so apologies, but I definitely encourage you guys to look on it on yourself. And I am at the advantage of having a laptop, so I can just go ahead and tilt this sideways and hopefully not drop it and make a big noise or whatever. But you notice the top has the NSAIDs, and there's a lot of ones we've seen already. Rationale: increased risk of GI bleeding. So these would be avoid or use with caution. So because increased risk of GI bleeding or peptic ulcer disease in high risk groups, including those aged greater than 75, or taking oral or parenteral corticosteroids, anticoagulants, or antiplatelet agents, because you'll hopefully remember that those all can increase the risk of bleeding. And the use of proton pump inhibitors or misoprostol reduces but does not eliminate the risk. So upper GI ulcers, gross bleeding, or perforation caused by NSAIDs occur in approximately 1% of patients treated for 3 to 6 months and 2 to 4% of patients treated for 1 year. These trends continue with longer duration of use. So because of that, the recommendation here, which is what I'm reading here sideways, is to avoid chronic use in your geriatric patients unless other alternatives are not effective and patients can take gastroprotective agents. So for example, PPIs or misoprostol. Quality of evidence is moderate. Strength of recommendation is strong, like my last name. And then you'll notice with indomethacin down here and Etodolac, and this includes the injectable. So these you should avoid, and quality evidence moderate. And this one actually has a stronger recommendation because indomethacin is more likely than other NSAIDs to have adverse CNS effects. Of all NSAIDs, indomethacin has the most adverse effects. Increased risk of GI bleeding, peptic ulcer, get my tongue right, sorry. Peptic ulcer disease and acute kidney injury in older adults. So please be mindful of that. Make sure you're noting that when you're studying for my course, but then specifically if you ever come across geriatric population. So there's a ton of stuff. You can download this tables. You can get these. So the most recent one's from 2015. You can just do a quick Google search and let me see. And they have a little pocket card that I think students like, or I liked as a student, but basically you can print this out or have it electronically. I'm kind of old school with as far as like I have everything on paper. I just like to reach out and touch something. No, but yeah, I like the paper or whatever. But this is a good little, it's 4 pages here you can print out and have, but it has different classes and stuff. We could find NSAIDs on here if we wanted. And then it gives the recommendations rationale. So hopefully that is helpful if you guys are on any specific rotations with geriatric, or you're going to encounter geriatric patients, inpatient, outpatient, etc. So I think that'll just be beneficial. Number one, anytime I give this presentation about Beers criteria, students always want to know what's on the test. So the specific things I mentioned about the NSAIDs and being, you should use caution with elderly. Yeah, that stuff's testable material for this module. But I'm not going to make you then memorize and study the Beers criteria and look at it. And for all the classes and stuff, it's way too much just for this module. So, just pay attention to the specifics I said about NSAIDs in the elderly, but then don't worry about going into other classes of medications and whether or not they should be used in the elderly population, unless, as always, I noted or it's on my slide or whatever. So hopefully that helped you guys out. As always, thank you guys for your time and attention. please feel free, getting all tongue-tied today, to email me any questions, comments, or feedback, and I will talk to you guys later.